Today we shall be discussing what is a Foley's catheter, what are the different parts of a Foley's catheter, how a Foley's catheter is inserted, and finally we shall be discussing what are the things you need to be aware before putting a Foley's to the patient. First thing guys, Foley's catheter is basically used to drain the urine out of the urinary bladder. So for those patients who cannot voluntarily go to urinate themselves, we use Foley's catheter. We also use Foley's catheter for those patients who are bedridden. So first of all, let us discuss what are the different parts of a Foley's catheter. As you can see, this entire thing is called as a Foley's catheter. Now within this Foley's catheter, you have got different parts. Now this opening which you see, this is called as the urine drainage port. Okay. Next, this part which is surrounded by the white bulb over here, this part is called as the balloon port. Okay. So I'll be explaining why is it called as a balloon port. And second thing, this region which you can see here, this region is called as the Y junction. It is called as the Y junction of the Foley's catheter. And all along this is called as the tip of the Foley's catheter. Now all of you can see very well that the tip has got a small aperture. Now this aperture will be located within the urinary bladder. This aperture will rest in the urinary bladder, through which this aperture will collect, or this opening will collect the urine, and the urine all the way goes down like this into the Foley's catheter and comes out of urine drainage port. After having said the parts of the Foley's catheter, the second important thing which you need to know is, now this thing which I am going to tell you is not visible here, but as you can see a small bulb like swelling over here which will be visible later on. So this bulb like swelling is called as the balloon. So I'll show you what is a balloon. But before that, one very important thing you need to know is that there are different sizes of a Foley's catheter. As you can see here, this is called as size 12. Okay, so this is called as size 12. So basically on the Foley's catheter there will be written FR12. What does FR stands for? Moreover, but anyways, we don't have a letter called as FR here, but most of the catheters, most of the Foley's catheters will have FR12, FR14, FR16, right? So what is FR stands for? FR stands for French gauge or French size. So Foley's catheter sizes start from 8 and all the way it ends till 26. So it ranges between 8 to 26, right? So there are sizes like 8, 10, 12, 14, 16, 18, 20, 22, 24 and 26. So each size is used to different age groups. For example, size 8 and 10 are used for children. Size 12, 13, 14, 15 and 16 are used for females. Size 20 and 22 are used for adult males. Okay. So as the size increases, the diameter also increases. For example, this is size 12. Now this size 12 has got a diameter of 4 mm. So in the same way, size 22 will have the diameter more than 4 mm. Okay. So now let us see how to insert a Foley's catheter. First important thing you need to know is the anatomy of the urethra. Now this is the part of urinary bladder. Now all along down here, this is called as the urethra, and this is called as the prostate gland, and this is called as the spongy part of the urethra. Now what are the different parts of urethra are? This is the prostatic urethra, right? And this one is called as the bulbar part of the urethra, and down here this is called the penile urethra. Now between the bulbar part and between the prostatic part, you have that part of urethra which is not covered by any tissue, and this is called as membranous part of the urethra. Mind you, membranous part of the urethra is the weakest part of the urethra, which is more and more prone to trauma or more and more prone to the damage. Point number 1. You take a Foley's catheter. Now, before you insert a Foley's catheter into the urethra till the bladder here, what is the first thing you do is that you take a lignocaine gel on your left hand here, exactly. Now, after taking this lignocaine gel, take the Foley's catheter, move this Foley's catheter within this lignocaine gel so that while you are passing this Foley's catheter, the gel around that will be useful for easy lubrication and it can very easily pass into the urinary bladder. Point number 2. Now, having taken this lignocaine gel, the important thing before you take the lignocaine gel, what you need to do is that you need to clean the area. You need to clean the male genital tract, you need to completely clean the male urethra, the penis, the pubic region, the scrotum, everything with a solution called betadine. Now you take the lignocaine gel on your left hand. You take the Foley's catheter with your right hand. You completely rotate the tip of the Foley's catheter like this in this way, so that the entire tip is attached completely lubricated with the lignocaine. Now you start inserting the Foley's catheter all the way into the urethra. Now, very important thing is that till where should I insert? Now in males, all of you remember that you have to insert till this Y junction. I told you previously that this is called as Y junction. You have to insert the Foley's catheter till the Y junction. It means this entire length of the Foley's should be within the body and this part should lie outside the body. So till the Y junction you have to insert the Foley's catheter. So now I am slowly inserting the Foley's catheter in this way. Now when I insert the Foley's catheter, I have to insert the Foley's catheter till the Y junction. The place is not sufficient, so I am inserting the Foley's catheter till here. Okay, so I insert the Foley's catheter. After inserting the Foley's catheter, the second thing I do is that I take a 10 cc syringe. Now, is it really necessary to use only 10 cc? Can I use 5 cc? Can I use 20 cc? Yes. How do you decide that? How do you decide that is that you can see a number here. This is 30 ml. It means this catheter can withhold distilled water of about only 30 ml. If you push more than 30 ml of distilled water or more than 30 ml of fluid, the balloon can burst out. So you can take the fluid up to 30 ml. But for safe side, I have taken 10 ml of fluid, 10 ml of distilled water. So right now your Foley's catheter is inside the urinary bladder. Now what I am going to do is I am going to take a 10 cc syringe, and I already told you that this opening which is surrounded by the white strip, this is called as the balloon port. Now I am inserting this 10 cc syringe right into the balloon port. Now after inserting this, all of you watch the tip. All of you watch the tip of the urinary catheter, what is happening there. So right now I am inserting here down, I am inserting into the balloon port. Now slowly I will push 10 ml of distilled water into the balloon port. Now when I am pushing 10 ml of distilled water into the balloon port, you can see the balloon inflating there in the urinary bladder, right? The balloon inflating in the urinary bladder. Now what the next thing I do is that I slowly pull the catheter down. When I slowly pull the catheter down, now you tell me, can this catheter come down beneath the urinary bladder? No, it is getting obstructed there. Why it is getting obstructed there? Because the neck of the urinary bladder or the opening of the urinary bladder is obstructed by this inflated balloon. This is how you put a Foley's catheter. Now, as I already told you, why you should not use normal saline. The reason why you should not use normal saline is that this Foley's catheter you are inserting in a patient who is bedridden. So you keep this Foley's catheter at least for 1 week or 2 weeks in a patient. So in that 1 week or 2 week time, during that time, what can happen is that if there is normal saline within this balloon, this normal saline has a tendency to crystallize. So it will form crystals. And these crystals can rupture the balloon. So when it ruptures the balloon, what will happen? The urine will leak outside the urethra. And second thing can happen is that these crystals can even damage the wall of the urinary bladder and cause bleeding. This is the first thing. And second thing, why you should not use air? The reason is that your urinary bladder is completely filled with urine. If you are using air to inflate the balloon, this balloon will rotate, this balloon will float in the air like this. So as it is floating in the air, this part of the urinary bladder is free, so urine will easily leak out. So that is the reason why second thing which I told you is you should not use air. You should only and only use distilled water for this thing to inflate the balloon. Third important thing what I am trying to tell you is that now you are putting this Foley's catheter all the way. Now when you are putting this Foley's catheter, do not inflate the Foley's catheter in between. Before do not inflate the Foley's catheter until you reach the Y junction. Why? Because if you are inserting the Foley's catheter in between, what is happening is that the membranous part of the urethra, by chance if you are in the membranous part of the urethra and if you have inflated the balloon, then membranous part of urethra is not surrounded by any tissue, so there are high chances that membranous part of the urethra can rupture and can bleed. So this can be fatal to the patient. Right. For example, there is an untrained nurse, and this untrained nurse practitioner, she tried to insert the Foley's catheter. Now, until she reached this Y junction, so as she is inserting the Foley's catheter, in between itself, she has pushed 10 cc of distilled water and inflated the balloon in the membranous part of the urethra. So the membranous part of the urethra will rupture obviously. So when it will rupture, can I still insert the Foley's? Can I take out the Foley's and put a new Foley's and still insert it? No. So in that case, you have to make a small opening in the bladder region. Where is the bladder located? The bladder is located above your pubis. So in the suprapubic region, you need to make a small incision and put a port over there and put a catheter over there. This is called as suprapubic catheterization. Okay. So in any kind of penile injuries, any kind of injuries to the penis, what you do is you never ever put Foley's catheter, and that is a contraindication. You always use a suprapubic catheter. So this is the way how you use a Foley's catheter. Now, once the patient is getting discharged, obviously you remove the Foley's and discharge the patient. Now, how do you remove the Foley's is that within this bulb, the fluid is of high pressure. So what you do is you take the same syringe, same 10 cc syringe which you have used before. Now what I am doing is I am inserting a syringe inside. Now when I insert a syringe inside, automatically the balloon will deflate. Look here. Because of high pressure, automatically the balloon deflates. Now once the balloon got deflated, you need to take the syringe out and slowly pull the catheter, or you are not supposed to pull the catheter fastly because you are not sure whether the balloon is completely deflated or not, and for that reason you slowly pull the catheter outside. You slowly pull the catheter outside and dispose this catheter. So this is the way how you insert a Foley's catheter and the rules you need to be aware before inserting a Foley's catheter, and finally how do you discharge or dispose the Foley's catheter outside. Thank you.